My name is Deirdre Murphy and I'm here today to tell my experience of cancer-associated thrombosis. I had no idea that there was a heightened risk of thrombosis with cancer diagnosis or cancer treatment. Realistically, I had no idea about thrombosis or cancer treatment, so it wasn't something that was on my radar. For my treatment, I received 2 different kinds of chemotherapy throughout my diagnosis. My first line treatment was through injections, and nothing was ever mentioned to me at the time about thrombosis or the risk of clotting. And when I moved on to the full intravenous chemotherapy treatment, I was advised I'd have to have a PICC line fitted, and at that point I was told the day the PICC line was fitted that I had a potential risk of developing a clot because I had the PICC line in sight. And I was told to look out for swelling and given a pamphlet when I left the hospital, but that was the only time it was mentioned. So I wasn't too worried. I had thought I had at that stage just an interesting thing had happened with my PICC line. But I did attend for my chemotherapy treatment the following week, and at that point a nurse did notice that she thought my arm looked a bit swollen in comparison to my other arm. She asked me, did I find it swollen? And I said, I suppose, slightly, but it wasn't alarming to me. And I think because it wasn't alarming to me, it wasn't alarming to her, and nothing was done about it. So it was 6 weeks later I had my line removed, and I'd say about a month after that, as I was starting the process of rebuilding myself post-treatment, that I had started to notice that actually the discomfort and swelling in my arm was still present, that the veins in my chest wall, in my shoulder, up into my neck, suddenly were really, really obvious. I looked like I had a lot more here compared to on this side. So at that stage I started to become concerned that something wasn't right. It didn't feel like an emergency situation to me, so it was potentially a couple of weeks before I spoke to my oncologist and I mentioned I was having these symptoms, and he took it seriously. He said the right thing to do would be to get it scanned. I suppose he also tried to address any fears that I might be having around it, and said, look, he wasn't terribly concerned about it. The line had been out for a couple of months at this stage, and you know, it could just be a lymphedema. It could be just my system coming right again after having had a foreign object in it for the best part of 5 months. So he arranged for me to have an ultrasound with a radiologist. And when the radiologist performed the ultrasound, he did it on this part of my arm. So the line would have been in sight kind of around here, and he scanned this entire part of my arm and the blood flow was perfectly clear. There was no issue, and the advice was, your arm looks symptomatic, but it looks fine. It could be a lymphedema, but if the symptoms persist, let us know and we can arrange for further treatment. At that point, I was still anxious because he had, in a way, ruled out for me an issue with a clot. So I was concerned of what could potentially be causing the swelling in the veins, and you know, I had enough physical enough of the physical kind of ramifications of cancer and chemotherapy going on at this stage. I was bald. I had, you know, lost weight. I now had like a blue chest. You know, there's a lot that you're trying to come to terms with, and I got fixated on the fact that I had this blue chest and this red arm and no answer for it. So I asked my oncologist who can help. What's the next stage if it's not an issue with my veins? He suggested it might be a lymphatic issue, and that a lymphatic nurse would be a good next port of call. And about a month later, I met that lymphatic nurse in the middle of March, and she took one look at my arm and said, what you have, Deirdre, is vascular. She could tell by the discoloration, the mottled appearance of the skin, the veins in my chest, and the slight but not dramatic swelling. Again, it was up to me to follow up with my oncologist to say I need further tests to rule something out. The lymphatic nurse believes I have a vascular issue, and they arranged for me to have a venogram. And that venogram occurred middle to late April. And lying on the table, I can still see it right now. I'm looking at the scan, the dye going in my arm, and as soon as it gets here to my subclavian vein in my chest, it just goes nowhere. It starts pushing out into all these lovely new veins that I'd all of a sudden started to see across my chest and my shoulder. At that point, the radiologist told me the vein was occluded. Language I've never heard before. Occluded, I now know means blocked. But the vein was occluded, and I had what he called collaterals. So all these lovely new veins were like tributaries. And I needed to wait a few days for that message to reach my oncologist, and for my oncologist to call me out of the blue and say, yeah, it looks like you have a thrombosis. A new word. So thrombosis hadn't been mentioned to me at the scan. And all of a sudden, I got the fear. I got afraid. So we went to meet the oncologist. He was going to give me a prescription, and he explained that there was a thrombosis, probably caused by the PICC line, that the protocol for that would be to go on a 3-month course of oral anticoagulant and to be rescanned after 3 months. And I was in shock because I had no idea what having a thrombosis in my chest meant. I'm not expert in this. The only time I'd ever heard of clots in chests were things like pulmonary embolisms. I didn't think you could get a thrombosis anywhere other than your leg. So if I was a medical professional and I was dealing with a newly diagnosed cancer patient who is about to start out on their journey of treatment, regardless of what that treatment is, I understand now that they are at a higher risk, a 1 in 5 risk of developing thrombosis. That's not something that anybody told me at the start of my journey, and I think it's very important that that conversation is had with the patient to let them know that this is a possibility, to let them know what the signs are to look out for. And I wouldn't have known what to look out for or mentioned it to my medical professionals. I think it would also be important to let a patient know what are the things that they can do to help themselves to maybe work towards avoiding something. If it's a case of keeping hydrated, keeping active where they can, but having some form of literature or a conversation with the patient, because it will help them not only look after themselves, not only watch out for something that could potentially, there's a 20% chance of this happening to somebody, that could potentially happen to them, but then help them not arrive in the situation I did where you end up confused. I'm angry that I actually tried to advocate for myself and tell people that this had happened and it was missed. And I'm angry that it took from September to April for me to have a venogram and to be put on the anticoagulant treatment, because there was no point really at that point. For me, knowing why I experience the symptoms I do, knowing what post-traumatic syndrome is, it helps me understand what's happening in my body. It helps me understand that I have effectively a 3-lane motorway filling my arm with blood and a 1-lane country road taking it back out. And my arm is heavy with blood all the time. And when I use it too much, it gets really tired because it's trying so hard to drain and do everything else. For me, I'm 5 years past the incident that caused my cancer-associated thrombosis, and it's only very recently that I have received the support that I've been looking for, and that support is helping me to understand what actually happened, giving me a formal diagnosis of what I now have as post-traumatic syndrome and advice on how to look after it from here on out. I would have preferred to have had access to that support and information, and the teams in the hospitals that provide the support to people day in, day out. In working to raise awareness for cancer-associated thrombosis, I think there's two audiences we need to consider. There's the medical professionals and then there's the patient. The medical professionals obviously get information about thrombosis, and in many different situations that I've been in the hospital, there's protocols for managing thrombosis or the risk thereof, you know, whether it's compression stockings on the leg, INAHEP injections when you're in for a long stay. I've had all of that, and I actually had all of that as part of my initial cancer treatment when I was bedbound for a couple of weeks. But it seemed to me that I fell between the cracks when it was a cancer-associated thrombosis to do with my PICC line. It wasn't picked up, and I wonder, is that because it's just not prominent enough, it's not advertised enough in those settings, and you have to remember the settings that I went into, it wasn't necessarily just the ward that was giving me the chemotherapy, but it was A&E. I presented to A&E with a blood clot and my line was cleared and I was sent home, and there was no conversation of anything I would need to do afterwards. I think that definitely at the start of a patient's journey, they need to be more aware of the risks. But actually, I met doctors and nurses every single week. And outside of the day I had my PICC line fitted, nobody mentioned thrombosis to me at all. And I wonder, is it worth becoming part of the checks that they do? Because they take obs on you all the time. They're forever checking your blood pressure. They're checking your temperature. So nobody was asking me on a weekly or a monthly basis when I was having my check-ins with my consultant, you know, are you symptomatic in any way? Have you had any swelling in your limbs, especially after I had the PICC line? How is your arm? Nobody asked me how my arm was. Never jogged my my mind on it. Never made me think that there might be something to look out for. So the reason I'm here today, the reason I'm sharing my experience of cancer-associated thrombosis, is because I don't think it is well understood from a patient's perspective. I think there are protocols that should be in place to stop a patient ending up in the scenario I'm in now, where I have a lifelong condition, I have post-traumatic syndrome. I shouldn't have this, because 5 years ago, when I had a clot and presented at A&E, I should have been put on anticoagulant therapy, and realistically I wouldn't have this issue now, and I wouldn't have had a 5-year struggle to get answers, and I wouldn't have had to deal with the extra health anxiety that that's brought with me for the past few years. And for me, the reason I'm telling this private story is to make sure people understand, make sure patients understand that this can happen, but make sure that the medical professionals, the doctors and the nurses, understand that if you don't react at the point in time that you can treat it, that patient you're helping to get better is actually going to be left with something for the rest of their life. And I'm telling my story because I think change is required. I think the education needs to be stronger in our hospital settings with the doctors and nurses that are supporting cancer patients. And if the protocol is for somebody with a PICC line issue to attend A&E, then it means our A&E staff, who I get are under pressure, absolutely need to understand the significance of a clot in a PICC line. So that's, if I'm telling my story today, I'm hoping that another patient doesn't end up going through the same journey that I've gone through.